Who qualifies for CI therapy?
CI therapy is most effective for people who can make at least limited movements with both the weaker arm and hand. Because CI therapy requires exclusive use of the weaker arm and hand for all daily activities, people with severely restricted movement will find it hard to participate because of limited ability and safety issues. CI therapy is not merely time-limited therapy, but it's a commitment to a different lifestyle. It's a major lifestyle change. So to get full benefit, one must be highly motivated to work hard. Even people with progressive conditions such as MS can still benefit from CI therapy. Those with MS showed improved arm function, increased use of the weaker arm, and less fatigue following CI therapy. 4 years after receiving CI therapy, half of the patients with MS still had better function than they did before they started treatment. Overall, about 95% of people treated with CI therapy report substantial improvement.
It has been years since my stroke. Will I still benefit?
Though most people notice the most rapid improvements in motor functioning in the early months after their stroke, there has been no relationship between the amount of time that's elapsed since the stroke and a person's benefit from CI therapy. Even people 20 years post-injury have shown a substantial benefit.
Can restraining the stronger arm during CI therapy produce weakness or poorer function in the stronger arm?
No. Even children who undergo CI therapy at age 2 or 3 when they're still developing motor skills do not show any lasting adverse effects for the stronger arm.
Does CI therapy also help with cognitive functioning?
In our laboratory, we have found no evidence that CI therapy improves overall thinking and memory. It does, however, help improve attention to the weaker side of the body, also termed hemispatial neglect, that sometimes co-occurs with motor weakness.
If CI therapy works so well, why can't people access it?
Most insurance companies don't cover it. Most patients can't afford the $9,000 that it costs out of pocket. As a result, most clinics can't offer it. There are specialty clinics that do offer CI therapy, but patients often have to travel long distances, oftentimes even out of state at a considerable expense. The amount of training required in CI therapy also involves a lot of clinic time, so it puts a stress on the clinics to staff for CI therapy. So between travel and scheduling burdens, there are huge barriers to making CI therapy accessible.
What is being done to help make it more available?
Recent research has used new technologies to help reduce the cost and travel burden of CI therapy. Our research team has worked with the stroke community to design a video game called Recovery Rapids. This game delivers portions of CI therapy. The game provides what research suggests are the most critical portions of the intervention: intensive practice and the motor activity log with problem solving.